Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together, we're
therapist.
the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Degenerative disc disease, or sciatica of the low back. We're going to show you 10 best exercises you can do for this.
Right. So the question is, are we talking about DDD or degenerative disc disease or sciatica or low back pain?
Could be all the same,
right? Right. You could have all three in one, or it could be separate. But I do want to kind of hit on this degenerative disc disease, and I've had viewers comment on it, and I think it's one of those terms, I really feel pretty confident that it's overused and it's a misnomer.
It sounds terrible.
Right.
I mean, I got a disease.
Right,
And
exactly.
it really isn't a disease. It's more degeneration. It's aging, right,
Right.
Brad?
So
in most cases?
Why listen to a couple therapists? So I went and did some research on it. I found a nice article by Dr. Peter Ulrich, and he came up with these exact same or very similar
Thoughts.
Exactly, that it's a misnomer, not a disease. It's pain from a lesion, or in other words, a problem with the disc, and it may be that the disc is shrinking. In overage, all of our discs do shrink. You know, when you get into
they
60.
they lose water and they get smaller and they compress down.
Right, that's simplifying it, but basically that's what happens.
It is simplifying it.
And the thing is about it, we'll show you one right here, as a matter of fact. This model, how does that look, Lonnie? You got it? Does it look
You want
clear?
me to hold it, Brad?
Sure. So you don't have, if you have a diseased disc, it's not red like this. It's just this model, so it's easy for instructional and educational purpose. There's a disc, but you can see the thickness of this disc. This and all these are thick, and
Good,
this
healthy disc.
Right. This one's much thinner. This one could be considered to have degenerative disc disease. It also has a herniation as well, and that may be part of the problem. That all works together, and then because of this, you get sciatica. So you can kind of see how everything can work together.
Could you see how if these two bones come together, that this hole gets smaller?
Right.
Where the spinal nerve comes out?
That's called the foramen. Foramen just means a hole, and yeah, if that hole gets too small, you pinch the nerve, sciatica occurs.
It's easier to pinch the nerve too. You know, not necessarily is it going to pinch it all the time, but there's not a lot of room in there. So if there gets some inflammation in there, it narrows up that hole even more.
Exactly. I'm going to show you another, actually an X-ray of the same disc.
Level.
Yep. And yeah, we're looking at it from this angle. If we look at some X-rays, okay, these are real live X-rays
So
taken.
it'd be like this.
Yep, there you
This
go.
angle.
Yep. So here's L2, which we're at here, then L3 and L4. Now look at here between L4 and L5. There is literally no disc between these two discs. And actually, this particular back has something called spondylolisthesis, and this is shifted forward, and we have no disc. And actually, this disc down here has changed shape. It's pie-shaped, and it should not be that way. It should like this. So we got two discs here with this.
With problems.
Right, exactly. Now, the other thing that Dr. Ulrich brought up was the fact that oftentimes with time, the disc can degenerate worse, but the pain can improve, which is good news. And actually, this one has done that exact same thing, and because this is my spine, this is my X-rays taken in 2000.
The big reveal.
Yeah,
This is your spine.
2013, and here 4 years later, my back is improving, although I am treating it properly, usually, doing exercises. But let's go through some exercises that you can do.
The point here that Brad and I try to make quite often is the body has a great capacity for healing.
Right.
If you allow it and you do things to make it not worse, I mean, it over time will try to solve the problems.
Exactly.
In most cases. By the way, if you're new to our channel, please take a second to subscribe to us. We have a subscription button over here or down below. We provide videos on how to stay healthy, fit, pain-free, and we upload every day.
Excellent, Bob.
All right, start off with some exercises.
Okay.
Brad.
So the whole concept, Bob, is we're talking about the core, okay, to support the muscles around the back that are having the problem. And not only that, but learn your back so that you know where the neutral position is. So if I arch my back this way, that's one end range, we call it. And if I
So the belt is kind of slanted down on that one.
And then if I go this way, I'm rounding my back. That's the opposite direction. We'd like to find kind of the midpoint in there, and that's where we want to strengthen our muscles, and so we keep that back in that mid-range.
Keep your pelvis in the neutral zone.
Exactly, exactly. Okay. Well, let's start out with
You're gonna lay down, or
You want to do them?
whatever you want to do,
Well,
Brad?
I tell you what.
You're gonna do 'em.
No, you
Okay.
do the first ones because I'm going to do the ones with the ball.
Okay.
And besides, I wanted to sit down, roll around on my stool a little bit. There you
All
go.
right.
Get a pillow, laying down. These do work better on a carpeted floor. You can do them on your bed. If it's a firm bed, that's better. If you're unable to get down to the floor for falling purposes, go on to bed. But firm bed is best. Okay. First thing, double knees to chest, Bob.
Would you start probably with single, Brad?
Yeah, we could
just maybe
certainly do
just
that.
stretch a little bit like this.
But then we're going to have 11 exercises, and we said 10.
All right. Well,
We'll add
count
a
this
bonus.
as one.
Bonus.
So I'm stretching this a little bit. Pressure
Sure.
on, pressure off, pressure on, pressure off.
Yep.
And then I'll bring them both up.
There you go. It is a good idea. And these
Pressure
should feel
on.
good on your back.
Pressure off.
Now, we've got 10
Pressure
or 11
on,
exercises
pressure
here. As Bob is exercising, you're probably going to find 2 or 3 of them that feel good, and those are the ones you're going to focus on. If any of them hurt, you just stop.
Yeah, we always try to make that suggestion. Find the movement that you can do that's going to be pain-free or make your pain better.
Right.
And that's the one you keep repeating.
Exactly.
So it's always an experiment, isn't it, Brad?
Exactly.
Next one, Brad.
Let's go to hook line rotation.
Okay, so you're going to bring your legs up, and then you're just going to go roll back and forth like
Right.
this. And again, you might find one direction that feels better.
Yep.
Well, work that one. If it feels better just going to the right, just go to the right.
Right.
And over time, you know, if it goes better to the left, go left, and you can maybe even go way over like
Yep.
this.
Notice how Bob's shoulders are flat.
Yeah,
He's not
staying down.
rolling the whole trunk. So that way we get some range of motion and rotation in the low back.
You could even venture way out here, Brad, if you want.
If that feels good, you do
Yep.
it. Yep.
Okay.
And
Do you want to do extension in line then?
well, yes, actually, good idea. Yep. Let's do
Okay.
the prone.
This is one that might make it worse, but I would try it.
Yep, I would too. Oh, Bob, look at your shirt. It's not tucked in anymore. How are we going to?
I'll get
What
it.
are they going to say? The people are going to start talking.
Slobby
Okay, here we
instead
go.
of Bobby. Okay. Now what? You want me to go up on the elbow maybe a little bit
Yep,
first to
you
get
could
a little
try this.
acclimated?
A static stretch, in other words, not moving. If it feels good, hang out there for a while.
Prone prop.
If it hurts right away, you might try it for 5 or 10 seconds. If it keeps hurting, go back down.
Yeah.
And then go to the push-up position, Bob.
And then I'm going to go probably halfway up to first start these and see. Again, is it making my pain better? Is it making it worse? Is it spreading the pain out? If it's spreading the pain out, it's getting worse.
Right,
So you want to see the pain get a little more localized.
right. If you have pain across your belt line and maybe down in your buttock, you want to, usually it'll come closer to the center of the back. If that's the case, you're doing the right thing.
I think most people know right away, Brad, if this is good. I
Right.
mean, they go, oh, this feels really good, or no, it doesn't feel really good.
Right. Especially in this case, yeah.
And if it feels good, you can work your way all the way up.
Right.
I mean, and try to get to the point where the pelvis is down, the arm is straight. Don't go like this where you're pulling the pelvis up. You're not doing
Exactly.
anything then.
Right, you're doing some core work.
You're doing
but-
some core workout. That's about it. Yep.
Yep.
Okay, Brad, what's next?
Yeah, I just wanted to mention, if you happen to are watching this video and you have pain, numbness, tingling all the way down your leg, then I'd work with that one a little bit and see if the symptoms come out of your leg. That would be a good thing. If you just have back pain with this, then we do it exactly how we mentioned it. The next one,
Pelvic tilt?
right, yeah, back on your back again. This one oftentimes we start out with because it's a basic range of motion. This is going to work good with your mic on here because we can watch that thing tilt.
Okay.
So there we go. See, so he's pushing his back down.
Yeah.
And you can
So if Brad had his hand in there, I would actually squish his hand.
ouch! I'm just kidding. But I can feel it squish my fingers.
So I'm moving the pelvis like this.
Oftentimes, this direction is what people are going to need to do. It also helps those core muscles strengthen in your
Yeah.
stomach. If you've never done any core exercises, this is a great place to start.
Keep breathing though. Don't
Yeah.
be holding your breath while you're doing this. This is a good one to wake up in bed and do a few of these, Brad. I mean,
Yep.
and same with the rotations. It's a good one to start off with.
People are going to ask about how many, Bob. I'm going to say 10 is a good place to start.
Yeah.
And you can go up to 15 and kind of get a feel. Once you zero down on the exercises you like, then that number can increase as long as it feels good and it gives you good results.
Right.
All right.
Where are we at next there?
Well, we want to do the pointer dog.
Oh, okay. You don't want to do supine crunches?
Well,
Oh,
yeah.
you'll do that with the ball or with
Well,
the,
I'll tell you what, Bob. Let's do this. I want to do this one because
Okay.
I want to use the ball. And
okay.
this is the way we work sometimes. We have to think about our exercises. Okay. So supine crunches, I don't care for the pillow. I like to do them like this, cross like that. Get your tie organized.
Yeah.
Actually, we don't do these at home with our tie on. Okay. And we're just thinking about getting our head and shoulders off the table. It's not like this, but it's like this so you don't stress that neck. There we go. And you don't have to do this thing where you go all the way up like that.
Right.
That's actually hard on your low back. Okay. We want to just work it up to here. Well, when I do these, I get my upper back to crack and feel good. It's a wonderful thing.
Really?
Oh, yeah, it's wonderful. Now, the other thing you can do, can I have that ball, Bob?
Sure can.
Put that right under my legs. If you happen to have a ball, use it for core exercises because it is one of the best things, in my opinion, for core exercises. You can do the same thing with your feet on the ball, and then if you're getting stronger, you lift them both up at the same time. Ball comes up, elbows to the knees, and they can touch. It doesn't matter. And the nice thing about doing this on a firm surface on the floor, Bob, is it forces your back to stay in that neutral position.
Sure.
I'm flattening my back just like we talked about before, and I'm doing a nice job of strengthening that muscle. This is a bonus too if you want to roll it back and forth. It's kind of like the hook line rotation. Okay, good. Now, the last two I want to cover is, hold that please,
Sure.
Bob. The infamous pointer dog. You arch your back, bring it up, and then go halfway in between, tighten up your stomach muscles. We're really doing some good core strengthening
I
here.
do these every day, Brad.
Can I have the ball?
Yep.
If you have a ball, I encourage you to do it like this. Because if that hurts your back, there's a good chance that this is going to make your back feel better with the same exercise. You can hear my voice. Now I can talk freely.
I started with this way, and then I progressed to without
Sure.
the ball
Yep.
because it was harder.
And you can bounce on the ball. It's kind of fun. Oh, darn. I thought
Brad,
I was going
in
to
Brad's world. Now he's going to knock all stuff over.
Yeah, we're going to tear the
All
whole
right.
department apart here. Wow.
Remember, Brad, we're not just pretty.
We're pretty ugly.
No, we're pretty helpful.
Oh, that's right. Helpful. Yeah, we do a good job helping
All right.
some people
Thanks
out
a lot.
somewhere up there.